Imagine for a moment that you walk down the street late at night. You find yourself having to cut through a dark alley to get home, when out stumbles what can only be described as a real-life zombie. Missing limbs, flesh still decaying on the bone as they menacingly shuffle towards you. Of course, zombies aren't real, but the substance used to turn people into these shambling husks absolutely is, and it's called Xylazine. It's been sweeping across United States streets, wreaking havoc everywhere it goes. Whether being taken on its own or being used to bulk out other drugs, it is dangerous, it is highly addictive, and it forms a fatal partnership with one of the deadliest illegal substances in the world. But what threats does this new narcotic hold? What is being done to combat its spread? And what is it that seems to make its victims both envy the dead and imitate them? This might just be the fastest growing and scariest new drug in the world. Okay, so what exactly is Xylazine and where did it come from? Well, it is a veterinary tranquilizer, pain reliever, and depressant of the central nervous system. Basically, it's a really strong sedative that's used on animals for medical procedures. Now, if you know anything about drugs, both legal and illegal, you will know it can be common for certain animal medicines to be used by humans. Ketamine is famously a horse tranquilizer, and fentanyl was used to knock out elephants prior to both substances' more notorious and illegal uses. And Xylazine is no different. But what is different is that unlike a lot of the drugs terrorizing American streets today, it is not an opioid, which actually makes its growth amidst the current US opioid crisis even more concerning. Not a huge amount is known about the drug's early days. It was synthesized for the first time in 1962 by the German company Bayer, operating in the western half of the country at the time. It was originally thought that it could be a human medication, but clinical trials were shelved after it caused nasty side effects, like a dramatically slowed heart rate and very low blood pressure. Because of the whole being a sedative thing. So, it was shelved for human use, but it seemed to work well on certain animals, especially larger ones like horses and cattle. So, from the 1970s onwards, it would be seen as a general veterinary tranquilizer, and it is very good at it, with it still being used for this very purpose today. And this gives it its nickname on the streets. It's called Trank. However, over the years, it would slowly start to integrate itself into illegal narcotic supply routes. It was legally attainable, after all, and had some pretty strong effects, so it would only be a matter of time before somebody thought, I wonder if that will get me high. Nobody seems to know where or when the first instances of the abuse of Xylazine was, but by the early 2000s, the tranquilizer was pretty common in places like Puerto Rico, just off of the US mainland. By the late 2000s, it had reached the notorious drug markets of Philadelphia and New York. It remained in obscurity as the opioid crisis in the United States continued to rise throughout the 2010s, and now in the 2020s, it is just starting to see widespread use as it goes more mainstream amongst hard drug culture. So, what has caused this relatively recent rise in popularity? Well, there are a lot of factors at play here. One is that it's really easy to get a hold of. It isn't that difficult to find online, as it's a totally legal substance with legitimate veterinary uses. Now, legal highs are often misinterpreted as safer by people who see less legal risk in using them, but that's not the case when it comes to health risks. In reality, the law is always playing catch-up to ban dangerous substances before they can affect the wider public health, and some of them slip through the cracks, like Xylazine. Another reason it has seen a rise in popularity is because it's both cheap and profitable. Addiction is a race to the bottom when it comes to prices, and because Xylazine is already mass-produced, it's pretty cheap to buy outright. It's also very profitable. Xylazine is a sedative, and as a depressant, it is often used to cut another narcotic substance to make it cheaper by bulking them out, but while crucially ensuring that the potency remains high. This is referred to often as trank dope, and depending on the dose and co-narcotic, the high can last up to 8 hours after taking it. It can be injected, ingested, or snorted. It can even be smoked. Any method for chasing the Xylazine dragon is available to people, which only makes it more amenable to all the various drug users out there. The high is very similar to the opioid kind of high, with the way it slows brain activity, relaxes muscles, and makes people feel drowsy yet euphoric. This means it can be used to enhance the effects of other drugs, either in terms of duration or strength. Drugs like fentanyl are cut using substances like Xylazine, which creates a deadly combination that is rapidly worsening the opioid crisis because of increased chance of overdose on multiple substances. But it's not just fentanyl. Xylazine is used to cut many drugs for potent chemical combinations, whether in THC vape, escapes heroin or speedballing cocaine, xylazine can be a part of many chemical cocktails. Unless you have access to facilities or equipment that can let you test your drugs, a lot of the dope ends up being trank dope because it's cheaper, making drug suppliers greater profits. According to the New York Times, when trank first entered Philadelphia's open-air drug markets in the late noughties, a bag of mostly pure heroin was about $10. Trank dope was $5. It's easy to see how addicts of a substance like heroin quickly fell into it, just like how heroin itself is cheaper than prescription pain pills. When the heroin trade from Afghanistan was cut by the Taliban by 95% after retaking control around 2021, other synthetic opioids like fentanyl and their accompanying drugs like xylazine suddenly had a gap in the market to fill. And such powerful drugs were all too ready to take over people's lives. Because that's the other thing about trank. It is hopelessly addictive. The way people describe their experiences with it remind you of the way people talk about heroin addiction, where people want to escape, but they can't seem to find the strength to do so because trank and its many associated drugs have too tight a hold on them. One user who was interviewed by the New York Times on her story stated, quote, "It was the beginning of my pregnancy. Xylazine is so addictive, so physically addictive, you just can't stop." It's pretty scary stuff, and this is reportedly owing to the very powerful withdrawal effects that xylazine has on people who use it. Early research suggests substance use disorder symptoms and withdrawal symptoms may be more intense for those taking xylazine with fentanyl versus fentanyl alone. One user said, quote, "It's like the flu times 100. I was throwing up a lot. I was just in a rotating pit of hell. So I was using." One of the many tragedies about xylazine is that those who are well-versed in trank would prefer not to take it. In 2022, an anonymous series of surveys on Reddit were conducted in the 7 subreddits identified as having the highest number of Reddit posts related to xylazine, with respondents reporting their patterns of use. Of the 61 respondents, 74% reported that they do not seek to buy or acquire drugs that contain xylazine. And yeah, the sample size here is small, but it does appear to reflect general attitudes about trank, that many people got into it by accident as a result of unwanted additives. When combined with fentanyl in particular, it appears to have a devastating 1-2 punch that is leading to increasing number of overdose deaths every single year. But how many are we looking at here? What is the scale of the problem exactly? Well, unfortunately, it's growing fast. So, we know where it came from and how it came to have a reputation both as a powerful sedative and as an extra ingredient that people didn't ask for. But you can't see how dangerous xylazine is until you see the numbers, and particularly the way they're trending upwards. In just 3 years, between 2018 and 2021, the number of xylazine-involved overdose deaths in the US rose from a relatively small 102 to a staggering 3,468. That is a 32-fold increase in just 36 months. The DEA has seized xylazine and fentanyl mixtures in 48 of 50 states. The DEA often tests the drugs it confiscates to find out what they're made of and try and stay one step ahead of an ever-evolving designer drug market. The DEA found in 2022 that 23% of fentanyl powder and 7% of fentanyl pills contain xylazine countrywide. One study from 10 US cities showed that xylazine was involved in less than 1% of drug overdose deaths in 2015. By 2020, it was 7%. Another report from the CDC's State Unintentional Drug Overdose Reporting System, or SUDORS, announced that the monthly percentage of deaths involving illegally made fentanyl with xylazine increased from just 3% in January 2019 to a staggering 11% in June 2022. We don't have more recent metrics to describe the true scale of the crisis today, but you can see just how quickly that xylazine has started to make its influence truly known. Okay, so other than being a bit like opioids in its effects, and the fact that it's monumentally addictive, what does xylazine actually do to your body to contribute to those increasing numbers of overdose deaths? Well, let's start with what it's described to do. It is a sedative, so it makes you drowsy by slowing brain activity, and those same side effects we mentioned earlier in the failed clinical trials, they reappear here. An extremely slow heart rate and dangerously low blood pressure are both reported in xylazine victims. This also tends to slow down breathing to the extent that it can even be difficult to breathe depending on the dose and what else someone has taken alongside it. In fentanyl, this is what creates the potentially lethal combination, as fentanyl already slows the body's vital functions. Take too much, and someone can easily go into respiratory arrest when they stop breathing entirely, and after that, people don't tend to last very long at all. It can also lead to loss of physical sensation in the body, as well as a total loss of consciousness. In that same anonymous Reddit survey that we mentioned earlier, 48 respondents reported unwanted effects from xylazine, 81% reported increased overdoses, and 17% reported increased emergency room visits. Now, the bodily effects we've mentioned so far are merely the trends identified in patients who had xylazine in their system, so it's fair to say this isn't an exhaustive list of symptoms overall. This is especially so as it's hard to know what to attribute to xylazine and what to attribute to other substances because they're so frequently taken together. But it only gets truly gruesome when the skin lesions start to appear. Repeated xylazine use is associated with skin wounds like ulcers and abscesses that typically appear on the site of injection. However, they often appear elsewhere on the body, and some clinicians report that these wounds happen even when people smoke or snort xylazine, but do not inject it. Over time, these can get badly infected, leading to patches of skin and tissue necrotizing to the extent that it starts rotting off of someone's own body. This is not dissimilar to the Russian gas station heroin alternative crocodile, which appears to have a similar necrotic effect. The reality is, in the US, when health insurance is so expensive and many drug addicts are left homeless on the street, there's nothing they can do to stop their wounds getting infected. If they're lucky, they might just need antibiotics. But if they're not, rare cases have been seen when people have to have limbs amputated when infection has reached the bone. Tracy McCann, an American user interviewed about her experience of this phenomenon, said, quote, "I'd wake up in the morning crying because my arms were dying." And that's not hyperbole either. Doctors are reportedly constantly perplexed by how xylazine causes wounds so extreme that they initially resemble chemical burns. Ms. McCann's trank-scorched forearms reportedly stank of rotting flesh whilst they oozed and itched constantly. When public restrooms are one's only source of clean water, you can see how hard it would be to keep on top of such a massive infection. The ulceration and rotting of the skin where limbs need to be amputated, combined with that drowsy shambling that many opioid and xylazine users experience, is what has caused people to equate them with the undead, with many referring to xylazine as the zombie drug. And when you consider that all before you even touch the fentanyl, you can see how xylazine acts as an accelerant for a person's physical and mental decline. The scale of the opioid crisis in general in the US makes the response to xylazine worse as well. Often when people are found having overdosed in the US today, it tends to be opioids, but both opioid and xylazine overdoses look and act very similar. Now, first responders and users alike are taught to utilize overdose-reversing drugs for opioids like naloxone, also known as Narcan. But giving someone who, for example, is overdosed on a mixture of fentanyl and xylazine, naloxone might not necessarily reverse things. As xylazine isn't an opioid, naloxone doesn't reverse its effects, meaning a person can continue to overdose from the residual xylazine still in their system, and they can still die. The antidote for xylazine is tolizolene, which is commonly used to reverse the effects necessary to complete a surgical operation. But that's not just something most people who aren't vets have laying around like they might with Narcan. Throw on top of that, people might not even know they've taken any xylazine at all because of how commonly it's added to other substances, as well as the fact that xylazine can help enhance other substances' effects, which mask its presence, and it can be a very quick way to land in your local paper's obituary. So, what's being done about all of this? Are crackdowns on xylazine coming, and can the genie even be put back in the bottle? Now, the last several years of xylazine's rise to prominence on the drug market have started to see some backlash from legislators in the Western world. In April of 2023, the White House designated xylazine combined with fentanyl as an emerging drug threat, which has enabled the implementation of an action plan and funding at the federal level to tackle the risks it poses. This also typically precedes a drug being scheduled as a controlled substance by the federal government. It's hard to totally outlaw xylazine because it does have legitimate and important uses, but labeling something a controlled substance will hopefully lead to more police oversight and tighter purchasing controls for individuals. Several states like Ohio and Pennsylvania have already rendered it a controlled substance, whilst Mexico and Canada have started to track imports of it into their countries. In July of 2023, the White House also released a national response plan to address the emerging threat of fentanyl mixed with xylazine. So across the board, in places like the US, it is finally starting to be seen as the serious threat to public health that it really is. It doesn't help that it exists in a legal grey area, but the more mainstream xylazine gets, the more likely that grey area will be ironed out by legislation. Other countries have started keeping tabs on Xylazine too. Countries in Asia do already ban it outright, and it was just scheduled as a Class C drug in the UK in 2025. It's not just the harsh punishments that come with such labels either. Labeling something as a controlled substance can also release funding for things like clinics and education programs for communities to combat the issues Xylazine causes. Harm reduction policies in the US, they're pretty minimal, but the pressure is growing from advocates in some parts of the country for things like supervised injection sites where people can use in safer conditions and even have their drugs tested. Xylazine test strips are slowly becoming more readily available, so people can at least make sure their drugs are safe one way or the other. At the moment, only 2 of these clinics for Xylazine exist in the US, and both are based in New York City. Such facilities can also help educate people to help them understand the damage that a substance like Xylazine can do to a person, especially over time. But at present, it's a losing battle. The trends on Xylazine continue to go upwards whilst it spreads into more and more countries every year, mainly as a heroin and fentanyl hanger-on. For example, according to Dr. Caroline Copeland from the School of Cancer and Pharmaceutical Sciences, Xylazine has already broken into the UK drug market, potentially exposing thousands upon thousands of people to its harmful effects. The first death in the UK, reported as directly involving Xylazine, was in May 2022. The BBC reported on the death a year later that the individual died at home and had a history of using narcotics. According to a report on the person's death from the Journal of Forensic and Legal Medicine, this person had Xylazine, cocaine, fentanyl, and heroin in their system at their time of death, and that they were likely to have purchased heroin not knowing it was laced with Xylazine, leading to predictably grim results. Others believe it's a losing battle. Sean Westphal is an outreach worker with Prevention Point Philadelphia who works in Kensington, the neighborhood at the epicenter of the city's massive open-air drug trade. When asked what can be done to help the Xylazine problem in the area, he stated, and we'll quote him here, "It's too late for Philly. Philly's supply is saturated. If other places around the country have a choice to avoid it, they need to hear our story." Meanwhile, people continue to suffer, a lot of the time from a drug they may not even have realized they were taking at all, let alone addicted to. Healthcare staff and people's families continue to fight for their loved ones and patients, but there's never enough money, equipment, or help to deal with the scale of the opioid crisis as a whole. Xylazine is simply another arm of the trade that makes things infinitely more complicated to untangle. Thank you for watching.